Let's talk about inflammatory bowel disease. As the name sounds, it is caused by an inflammation of the gut. There are two kinds of inflammatory bowel disease. One is called ulcerative colitis, which affects mostly the large intestine and the colon. And the inflammation is like in a continuous pattern. The other one is called Crohn's disease, which can affect any area of the digestive tract, starting from the mouth all the way up till the anus. And it is also characterized by inflammation, but the inflammation can occur in patches and can occur through all the linings of the gut. With ulcerative colitis, the inflammation is generally limited to the innermost lining of the gut that actually sees the food. The thing that we have to remember about inflammatory bowel disease, or IBD, is that it's not caused by food. The actual cause of the disease is actually not known. Some say it's genetic. It can be due to environmental factors. A really big hypothesis out there is that it's an overreaction of the immune system, or like an autoimmune disease. But nobody really knows what's going on with inflammatory bowel disease. The only thing we know is that there is an inflammation. Yes, there are treatments for it, which are trying to reduce the inflammation in the system as such, but there is no cure yet. Also, there is no cure because the exact causes of this disease is unknown. There are about 700,000 people in the United States alone who are affected by inflammatory bowel disease. We have to remember that inflammatory bowel disease is actually different than IBS, which is irritable bowel syndrome. Irritable bowel syndrome has to do with the musculature of the gut. There is abnormal cramping and pain and contractions of the muscle. But IBD is actually caused by an inflammatory response. The symptoms of inflammatory bowel disease can be very debilitating. It includes frequent and recurring diarrhea, fatigue, low energy, weakness, blood in the stool, fever, and weight loss. Nobody knows why it happens, and the symptoms varies. Even though it's a chronic disease, there can be periods of intense flare-up and then periods when the inflammation has gone into remission. No particular triggers have been identified for IBD, and that's why it becomes very challenging to treat it. There are many clinical trials out there that are trying to find a cure for IBD, ulcerative colitis, or Crohn's disease. Many pharmaceutical companies are actually putting in a lot of efforts to cure this disease. So if you find one in your area, participate today.